learners, welcome to another mini lesson. This time we're going to talk about the female reproductive system and contraception. The methods of contraception are broken down into behavioral, barrier, intrauterine, hormonal, and surgical methods. Now, to be fair, in my own opinion, contraception and STDs should be discussed in both the male and female reproductive system chapters, but they have them in the female reproductive system, but it is what it is. So, let's first point out that unprotected sex with no form of birth control has a failure rate of about 85%. That means that every time you have unprotected sex, there's an 85% chance that the act will result in pregnancy. So let's start with behavioral methods. Abstinence simply means that you don't engage in sexual intercourse at all, by any means. And it is 100% effective if, and that's a big if it's followed consistently. The rhythm method is a form of contraception that follows the woman's menstrual cycle and monitors basal body temperature to determine when a woman is ovulating and most fertile. By avoiding intercourse during these times, it's thought that the pregnancy can be avoided. However, it's often difficult to determine the exact days, and therefore it has a high failure rate with this method. Coitus interruptus is sometimes called the pull-out method and involves the male withdrawing the penis before ejaculation. This is definitely not a reliable form of contraception and has a high failure rate. Now let's look at some barrier methods. The first one on the list is condoms. Condoms are a sheet of latex or rubber that are either rolled over the erect penis or inserted into the vagina. Male condoms are more common than female condoms. Male condoms, when used correctly, can have a success rate up to 98%, and both male and female condoms are also very effective in preventing STDs. A diaphragm and cervical cap are basically a latex or rubber dome that's inserted into the vagina and placed over the cervix to prevent sperm from entering the uterus. They can be combined with a spermicide, which increases their effectiveness. A spermicide can come in the form of a foam or a gel and can be used alone or with the diaphragm or condom or vaginal sponge in order to kill the sperm cells. Remember, the ending "side" in spermicide means to kill. So the spermicide just acts to kill the sperm cells that it encounters. The vaginal sponge is another barrier that's placed inside the vagina to prevent the sperm from entering the uterus. It's made of a soft, squishy foam that's coated with a spermicide and acts as both a barrier and chemical agent. Currently, there's only one brand of sponge available in the US. Intrauterine devices are abbreviated IUD. These are T-shaped flexible devices made of copper or plastic that are inserted into the uterus and left in place for up to 4 years. These devices trick the uterus into thinking that it's pregnant, so no further pregnancy can take place. They are very effective, but there are risks involved. These include infections, movement of the IUD, a small chance of getting pregnant with the IUD in place, also PID. And additionally, the IUD does not protect against STDs. Let's move on to hormonal methods. There's many types of hormonal contraceptives available. Oral contraceptives are commonly called birth control pills and come in many combinations of estrogen and progesterone to prevent the development of follicles and ovulation. They rely on consistently taking the pill on a regular basis. It should be noted that oral contraceptives can be taken for other reasons besides preventing pregnancy. These include controlling symptoms of severe PMS, preventing migraines or controlling migraine symptoms, severe menstrual pain, acne, irregular or heavy menses, endometriosis, and PCOS. Estrogen and progestin patches also deliver hormones, but in this case, instead of oral contraceptives, they come in a transdermal patch, which allows for a more consistent delivery. The patches may be monthly or weekly, and when used correctly, they can have up to a 98 or 99% success rate in preventing pregnancy. Something similar to the patch, which is not mentioned in your book, is NuvaRing, which is a small, flexible silicone ring that's inserted into the vagina. It's replaced once a month and releases a steady flow of hormones. Injectable progestins like the Depo-Provera shot can be given every 3 months, and this is a good option for someone who doesn't want to have to remember to take a pill every day or to change a patch once a week. The shots are usually tolerated pretty well, with some of the normal expected side effects from hormonal therapy, like irregular periods, weight gain, and headaches. For more long-term options, implantable progestins are available. These are small silicone tubes that are inserted under the skin and slowly release progestin for up to 5 years. They have a high success rate and a few side effects, including abnormal periods, weight gain, complications at the site of the implant, and a risk of ectopic pregnancy. It should be noted that your book gives the name of the drug Implanon. However, that drug's been discontinued and it's been replaced with something called Nexplanon. So just an update there. The last two hormonal methods in your book are a little controversial. They're listed as contraceptives, but many people think that they should not be listed as contraceptives, but rather as backup methods in the case of what to do after having unprotected sex. The so-called morning after pill, like Plan B, contains a large dose of progestin, which will inhibit or delay ovulation when taken within 72 hours of unprotected sex and will prevent pregnancy. Mifepristone is a drug also known as RU486. It's sometimes called an abortion pill, which can be taken with a prostaglandin to induce a miscarriage or abortion. Remember, the term abortion means termination of a pregnancy, and as a healthcare provider, you are to remain non-judgmental. The pregnancy could be wanted or unwanted, and the termination could be done for a number of reasons. The last two methods of contraception are surgical methods, and these are semi-permanent methods of sterilization. Tubal ligation is sometimes referred to as getting your tubes tied, and it's performed either laparoscopically or sometimes during a cesarean section if the mother knows they are not going to have any more children. In this procedure, the uterine tubes are cut and a segment is removed, and the ends are tied off or ligated, and then cauterized or burned closed. If in the future she decides to have more children, a tubal anastomosis is done when the tubes can be rejoined. Anastomosis just means a reconnecting. A vasectomy is a similar procedure in the male, where the vas deferens are cut and tied off and a section is removed. And in the same way, this procedure can be reversed. The keynote here is what I said in the beginning of the video. Unprotected sex has a failure rate of 85%, meaning every time you have sex without using some form of contraception, there's an 85% chance that the event will result in pregnancy. Some word analysis to be aware of here: contraception and contraceptive. Contraception is the noun form of the word. So, for example, the use of condoms as contraception has cut down on the incidence of STDs. Contraceptive is the adjective form of the word, so it describes something. The next term is ligature and ligation. Ligature is a noun that refers to something used to tie or bind, like a wire or a thread. Ligation is the process of using a ligature. For example, in tubal ligation, the uterine tubes are tied off with a ligature. And in the last example, the word diaphragm has two meanings. In this chapter, we're referring to diaphragm as the dome-shaped contraceptive that fits over the end of the cervix. But remember, it can also refer to the dome-shaped muscle of respiration in the chest. Only a few abbreviations in this chapter. IUD stands for intrauterine device. RU486 was the drug mifepristone that induced miscarriage. And IVF, we didn't really talk about, but it's mentioned in your chapter. I think we talked about it on a previous video. This is a fertility treatment where a sperm and an egg are combined in a petri dish in order to conceive a child. So that's it for this mini lesson. Check back for the next one, which will focus on diagnostic and therapeutic procedures. Thanks as always for your attention.